Now, what is a good death? Well, for many people suffering from terminal illness, it's the opportunity to die at home, surrounded by their family. Since the pandemic began, the number of people who've died outside the normal hospital setting and at home has risen by 41%.
The increase is likely to have been driven by restrictions in hospitals during COVID, and charities say the sudden rise could be placing a strain on end-of-life care services available at home. Our social affairs correspondent Chris Clements has this report.
Both my parents were of the mindset that a nursing home or a care home was not for them. They would want to be looked after or live in their own home.
Anne Curry died at home last August from motor neuron disease, months after the sudden death of her husband Jim. In her final weeks, she'd been in hospital recovering from an infection. She'd been ready to return home, but her condition had deteriorated. She'd now need 24-hour care provided in a nursing home.
To be fair, social work actually agreed that she couldn't go home. However, they said that they didn't have any other care provision. There wasn't anything else within our local authority. The time that I could have and should have spent with her was very much shortened by the fact that I was having to try and negotiate and find somewhere or something that could support my mum where everybody would be happy with, including her.
Over 4 weeks, Inverclyde Council continued to assess Anne's support needs. It told the BBC the council doesn't retain a pool of staff to draw on in these situations, and it can take time to establish extensive support. In her last week, after help by MND Scotland, Anne secured 24-hour care and returned home.
It probably doesn't sound a lot of time. 4 weeks is not a long time, but when you're constantly trying to fight for something, 4 weeks is a lifetime. And 4 weeks was my mum's lifetime. I feel, did she know? Did she know that she was home? And that's not okay. She should have been aware that she was home, and her wishes should have been granted a lot sooner.
Anne is one of more than 26,000 people who died at home or outside a hospital or care setting during the pandemic. Since 2020, there have been more than 7,800 more deaths in the community than the 5-year average, a rise of 41%. Only 500 of those excess deaths came from COVID. A larger number, nearly 3,000 deaths at home, were from cancer. That increase has likely been driven by restrictions in hospitals during COVID. With limited access, it means those who would normally die of long-term illnesses have been more likely to die at home. But outside traditional care settings, what have those deaths been like?
And what we are hearing, and a recent survey that Marie Curie has carried out found that 3/4 of carers looking after someone with a terminal illness struggle to get the care and support they needed. And if we're going to continue to see this trend of people dying at home, then we need to make sure that they are getting the care and support that they need. Over the next 20 years, we're going to see increasing numbers of people dying of with palliative care needs and terminal conditions, part of our ageing population. And we're expecting that over 60,000 people by 2040 will need some kind of palliative care.
Mary is 78 and has bone cancer. Diagnosed in February last year, she was given 2 years to live by doctors. Mary has been planning her own death at home with the help of Marie Curie.
I've thought a lot about that over the 2 years. So when I took ill myself, I started to get a bit anxious about end of life. How would my family feel? Would they object to me dying in hospital? Or would they rather be with me at home? I was very, very anxious. There were tears every day. Would I be alone? Would I be sad? Would I be frightened? And after I discussed it with my husband, the children, in that order, and Marie Curie, I feel far more relaxed now. I'm quite happy. I know now that my family's going to be with me, and they're happy, and I'm happy, and I won't be afraid. I won't be afraid to go. because I know that they're happy and I'm happy and I'm great.
The Scottish Government says it's researching the wider impact of COVID on the population and plans a new palliative care strategy in the next 5 years. Chris Clements, BBC News.